Can potassium levels affect edema, swelling? Have you ever wondered how something as simple as potassium could impact swelling in your body? This is a fascinating topic, especially when we consider its connection to hypertension and overall health. Edema, which is the swelling caused by excess fluid trapped in tissues, can be influenced by potassium levels. Potassium is an essential mineral that plays a vital role in regulating fluid balance and blood pressure. When someone has hypertension or high blood pressure, maintaining proper potassium levels becomes even more important. This is because potassium helps counteract the effects of sodium. When there is too much sodium in the body, it can cause the body to retain water, leading to increased blood volume and pressure on blood vessel walls, which can contribute to swelling. Potassium helps the body excrete sodium through urine. This process can reduce fluid retention and lower both blood pressure and swelling. However, it is important to note that both high and low potassium levels can create problems. High potassium levels, known as hyperkalemia, can occur in people with kidney issues, which are common in those with long-term hypertension. If the kidneys are not functioning well, they cannot effectively remove excess potassium. This can lead to elevated potassium levels, which may cause symptoms like muscle weakness and, in some cases, swelling due to fluid imbalance. On the other hand, low potassium levels, referred to as hypokalemia, can worsen hypertension and lead to fluid retention. When potassium levels drop, the balance between sodium and potassium is disrupted. This imbalance can result in increased sodium retention, which promotes swelling. For individuals managing long-term hypertension, regular checkups often include monitoring potassium levels. This is vital because both potassium deficiency and excess can impact blood pressure control and fluid balance. Adjusting potassium intake through diet or medication can help manage hypertension and reduce the risk of swelling. For instance, increasing potassium-rich foods like bananas, oranges, and spinach may help lower blood pressure and decrease fluid retention in those without kidney issues. However, for patients with kidney disease or those on certain medications that affect potassium levels, careful management of potassium intake is essential to avoid complications. In summary, potassium levels do indeed affect edema in the context of hypertension. A proper balance of potassium helps regulate sodium and fluid retention, which influences swelling. Monitoring and managing potassium is an important part of long-term hypertension care to control blood pressure and minimize swelling.